The most difficult adjustment between high school to college for me, besides having so much extra freedom, because structure does help you whenever your schedule's so full, but the biggest adjustment for me was taking on the responsibility of getting my own medication and handling my own insurance and working out my own doctor's appointments to go with my new adult schedule. I had a difficult time at first balancing everything. You really have to take the time to work it into your schedule. But eventually you do get it all together and it's not so catastrophic and disorganized. Eventually you realize if you have to get everything in a row and it'll all work out fine.
To help me be independent when I left home, my parents were very good, especially my senior year of high school, they nagged me less to do my treatments other than a little reminder. And they let me do it by myself because they knew once I left to college, it'd be completely on me. They can't be there for me every day like they were in high school, and it becomes my responsibility once I leave. And them just letting me do my thing and be myself and knowing that, and reminding me that I would have to face the consequences if I didn't do my treatments helped me a lot when I was growing up.
When I first went to college, I enjoyed the freedom of taking on my own health care. For so long, my mother had done it for me. I felt like at times I didn't even know what medications I was on. So really, in taking over my own health care and being responsible for it, I feel like I learned more about my disease. I feel like I'm more in tune with my body. Like, I know when I feel bad, whereas before I would run myself down. And trust me, my mom is still very involved. Text messaging and calling and emailing, and there's not a day that goes by that I'm not nagged at some point.
For parents, the big thing is learning how to actually let go, to let them start taking control and responsibility for their own treatments. And it's really hard to stand back and not say anything, but they need to do this on their own. They'll have to at some point, because if they do find a cure, you want him to be able to be as healthy as possible.
It's definitely harder without the constant reminders from your parents, because when you're in college, there's so much to do, and having cystic fibrosis is like having a full-time job. And so it takes a lot of work to make sure you have enough time in your schedule every day to get your treatments done. And I still get calls from my mom about making sure I do my treatments.
Just in regular conversations with him, how are you doing on your treatments, honey? Are you doing them like you're supposed to be doing? And I know that he told me that he actually does better away from us than he does here when he's up here, because here he gets busy with things, and down there he's actually set a timer on his phone so that it reminds him that he needs to do a treatment, especially in the afternoon. The evening one's the one that tends to get lost sometimes. So he has, I think he said 2 timers, one that goes off around 2:30 or so, and then one that goes off later in the day in case he missed doing it at 2:30. And I thought that was pretty smart.
Make sure that you encourage them just to have the best time they can, be a regular college student, be involved in college life, and just try to have a really positive and good experience with your school years.
To learn more about this issue, ask your CF Foundation Accredited Care Center or contact the CF Foundation directly. Call 800-FIGHT-CF or email us at info@cff.org.